Hi guys, I am now 31 weeks pregnant and I have had a cough and cold for the past 2 weeks. So this is top of mind because the skill of being able to correctly hug the baby and activate your deep transversus abdominis and pelvic floor is a game changer to prevent leaking, incontinence, and sometimes excessive diastasis recti when the middle of your six-pack muscle starts to overstretch. Okay, so what's going on here? Coughing is very, very difficult for your pelvic floor because it represents a sudden blast of pressure as you, sorry for the visual, but as you really cough, there is that outward and downward pressure. So what we need to do is try to kind of guard against that as best we can. The baby is already creating constant pressure. So if we are learning properly how to activate our pelvic floor and our deep core, we can mitigate some of that pressure, especially during exercise and if we have had a cold for a long period of time. So I want to show you a very easy way of practicing this at home. It's visual, so you might want to look in a mirror, take your hands and just put them just above the pubic bone, like you're cradling your belly for a lovely maternity photo shoot. So I'm going to show you sideways. I'm going to show you the first version. This is what we want. The second version, what we don't want. So first version, what we want is we want the belly to go in and up. Most important thing here, if I could write up on a chalkboard in big letters, that's what I would do, okay? So inhale, expand. And on my exhale, I'm not gonna move my hands. I want you to look at the low belly and how it is going up. Okay, inhale, I'm letting go. One more time, what I want you to do is exhale, lift your pelvic floor, and hug that baby in and up. So I'm feeling it in the area just above the pubic bone. What I don't want you to do is just suck in. Notice that when I just suck in, I don't get that lift. I'm actually feeling downward pressure right now. So instead, this is what I want. I'm gonna go up and in. From the front, the version we want is exhale versus sucking in, where I'm just kind of bracing and I don't get that navel sliding up. This is such a game changer, guys. Look in the mirror, practice at home. I'm really hoping that that is helpful for you. See a pelvic floor physio if you are suffering from any incontinence, and even just a little bit, it counts, okay? It all counts. So go see someone during your pregnancy. Be proactive. I am on your side if you have any questions, and best of luck. Mwah.